Welcome back to part 2 of our 3-part vlog series on information blocking and information sharing. This is Jessica Zeff, Director for Product Compliance here at NetHealth. And if you recall from our last session, we talked about the 21st Century Cures Act as the driving force behind current efforts at health information sharing. And we left off promising to take a deeper dive into the regulations. So let's go for it. A key feature of the 21st Century Cures Act is its emphasis on making health information more accessible, both to patients and their representatives, and to providers who are involved in providing treatment and care to patients. If you take anything away from this vlog, it should be that policymakers are intent on making it easier for patients to access their data and for healthcare providers to share health information about patients they have in common. And that really is the crux of information blocking and information sharing, making data more accessible. But how do you make this happen? How does that happen? All right, so first, the 21st Century Cures Act bans what's called information blocking. The Office of the National Coordinator, or as some might know of it, the ONC, defines information blocking as a practice by a health IP developer of certified health IP, health information network, health information exchange, or healthcare provider that, except as required by law or specified by the Secretary of Health and Human Services as a reasonable and necessary activity, is likely to interfere with access, exchange, or use of electronic health information. That was a mouthful, I got to agree. But to put it simply, information blocking is any activity that prevents access, exchange, or use of patient health information, and to which none of the rules exceptions apply. So in other words, unless a regulatory exception applies, any failure to share patient information with a patient or a healthcare provider involved in a patient's care could be considered information blocking. But what patient information are we actually talking about? Does a healthcare provider need to share everything under the sun? Good point, I say, and that brings me to my second point. The 21st Century Cures Act specifies that only certain pieces of data or data elements must be shared, and specifies that we must share those data items included in something called the United States Core Data for Interoperability, otherwise known as USCDI, which I mentioned in our very first blog. So what is USCDI? Well, it's a list of different data types that must be capable of being shared when they're collected. So for example, patient first name, last name, date of birth, treatment plan, care team members. There's a list of what should be collected in order to be compliant with USCDI requirements. And there are too many of those different requirements and data elements to discuss here, but you can find out more on the ONC website. I should also add that USCDI elements are changing. USCDI data elements started out with just basic patient demographic and clinical information about a patient, but it's being expanded to include information about social determinants of health. So watch out for that. Currently, version 1 and version 2 of the USCDI have been finalized, and there is a version 3 that's in draft and out for comments. So telling you all of this about USCDI requirements is simply saying that the 21st Century Cures Act requires the sharing of any patient information that's listed as a category in the USCDI, and failure to share this information, subject to any exceptions of course, could be considered information blocking. Now, keep in mind, one last point, that as of October the 6th, 2022, All patient electronic health information must be capable of being shared, exchanged, and used. This is a much broader category of health information than is specified in the US CDI. Right. So we've talked about the context of the 21st Century Cures Act. We've defined information blocking, and we looked at US CDI data elements. In our next session, we'll look at how we meet information blocking and information sharing requirements. Right, so thank you everyone for listening, and we'll see you next time.